Let's suppose that in a family there is mom, dad, little brother who is 5 years old, and older sister who is 12 years old. Little brother still enjoys coloring with crayons, playing with his toys, and taking a nap. But older sister seems not to be there anymore. Since her birthday, when she got a nice smartphone with the latest technology on internet connection and easy access to social networks, which has allowed her to post videos, photos, communicate with friends from far away, and show them how awesome her life is. And also kill some time with some fun little games whenever she feels too bored. But there's a problem. Mom and dad feel like they're losing the connection they had with their own daughter. Now she seems to be more interested communicating with friends through the pixels of a screen than talking to her own family. Now let's suppose that this is your family. How would you feel having to communicate with your own daughter through text messages? Something close to this is reality for many families in today's world. The excessive use of social media and technology is harmful for young children. The American Academy of Pediatrics and the Canadian Society of Pediatrics state infants aged 0 to 2 years old should not have any exposure to technology. From 3 to 5 years old, they should be restricted to 1 hour per day. And from 6 to 18 years old, they should be restricted to 2 hours per day. Children and youth generally are having 4 to 5 times the recommended amount of technology. A 2010 Kaiser Foundation study showed that elementary-aged children use about 7.5 hours per day of entertainment technology. 75% of North American homes have the TV on all day. Just as alarming as this is, 1 in 11 children aged 8 through 18 is addicted to technology. And what are the consequences of this? The pediatric occupational therapist Chris Rowan and author of Virtual Child, A Terrifying Truth About What Technology is Doing to Our Children, on an article she wrote for the Huffington Post, talked about this. She said that children are getting physical, psychological, and behavior disorders. Obesity and diabetes in children are a common thing in Canada and the US, which is related to technology overuse. Diagnosis of ADHD, autism, coordination disorder, developing delays, unintelligent speech learning difficulties, sensory processing disorder, anxiety, depression, and sleep disorders are also consequences of technology overuse, and they are growing rapidly. I don't blame technology for all these issues. The real problem is that the parents sometimes seem to be more worried to provide technology devices for their children than actually talking to them. How to stop this? Me as a son, and I mean this from the bottom of my heart, and respectfully for those of you that are parents. I grew up in a family where mom and dad worked all day during the daytime and came back when I was sleeping. If I would have had them with me, probably I wouldn't have some of the mistakes, and I wouldn't made some of the mistakes I had in my youth. Having parents to learn more about their children and how they're doing and what they're doing with the time they spend with technology and managing what they do with effective communication to strengthen the relationships they had is probably the best solution we can come up with. Do you remember the example at the beginning of my speech? What would it happen if mom and dad spent more time with their 12-year-old daughter? If they actually cared to communicate with her? I'm glad to say that I grew up playing with my friends, having fun with them, playing ball, ran outside, playing with my toys, and imagining I was the character of one of my favorite cartoons in an adventure. And those were really good times. Thank you.